Okay, sorry. Okay, take two. Welcome, everyone. My name is Gretchen Grapponi. I'm a licensed clinical social worker and trainer here at Boston University, and I coordinate the Knowledge Translation Academy for the Center on Knowledge Translation for Employment Research. And I'm excited to be part of today's presentation on using an equity framework in employment practice implementation with Dr. Anna Bowman. We are recording this webinar and ask that you please keep yourselves on mute to limit background noise. Today's event is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. The content of the webinar does not represent the views or policies of the funding agency. The territory on which Boston University stands is that of the Wampanoag and Massachusetts people. And I include this land acknowledgement as a way to honor and respect the history and continued efforts of Native and Indigenous communities, and also to invite the truth into our discussion over the next hour. And I'm going to have our speaker, Dr. Anna A. Bowman, introduce herself. And before that, I'll just say that in addition to me being a licensed social worker, I'm also white, I'm gay, and I have lived experience of mental illness. And now I'm going to hand it over to Anna.
Thank you, Gretchen. Welcome, everybody. This is an honor, a privilege to be here. I'm Anna Bowman. I am a faculty at the Washington University St. Louis. Yes, Gretchen, I was wondering if you slideshow might be. Excellent, thank you. You will see my Twitter handle in there. And one of the reasons that I use and I share my Twitter handle is because I have been using, and several of us have been using Twitter as a platform for advocacy, for sharing information, for engaging, for collaboration, and co-creation of several things. So as it relates to me, I'm talking a little bit slow because I see that several people are still joining us, Gretchen. So I'm wondering if we can slowly introduce ourselves.
Sure,
I see some really interesting names that I would love for people to engage and join us. So I am Anna Bowman. I am, in terms of my own geography, I am a Latina. I'm from Brazil, hence the accent. I am able-bodied, white skin, cisgender female woman. And so a big chunk of why we're positioning ourselves is, as we will talk, when we talk about equity, our own lived experiences permeate and affect the way that we talk, the way that we engage, the way that we, and I will say, struggle with equity and equity in work. So I welcome you guys. This is a workshop. I will say that we have not a lot of slides, and the goal of this is more of having a conversation than a presentation. And so I hope that you guys can engage with us, ask us questions, use the chat, and have a conversation. We do want to acknowledge our funding. I am a research faculty at WashU, which means that I have the honor and privilege of collaborating with many people, hence my multiple funding. Wait, Gretchen, what's happening? You might have, if you take it out of slides presenters, you might have had it in terms of presenting with timing, which is great. So now I can see the names. So welcome everyone. If you feel so inclined, if you can add in your chat your name and where you're coming from, that will be also very helpful to us to get to know each other and get to know you. Yeah.
Can you see
Welcome,
that?
Wendy. Yes. Can you add in? Can you do it in the presenter mode?
Sorry, it's
one I can share. I have the slides here if you want me to share.
I can do it. I'm sorry. It's since I'm recording. It's
Oh yeah, you see the. It's hard to see things. Yeah.
I will get there.
Hi, Susan.
Sorry, everyone.
Hello, John. Diane. So as Gretchen is pulling out, hi Kelly, is pulling out the slides, I'm wondering if you feel inclined and brave. One of the questions that we have in our slides, in our next slides, would be, how would you define equity, and how would equity look like in your work? And there's a reason why we're asking this question. So I am from academia. Equity in my context in terms of as a research faculty might look very different depending on if I look at my peers, faculty, equity in terms of staff, equity in terms of my research agenda. So when you think about equity, what would equity look like for you and in your work? And you feel want to add to the chat? Or how would you define equity? This is okay. Or you can say, I don't know how to define equity, and that's why I'm here in this workshop, Anna. It's absolutely fine. Okay, secure and seek funding. Thank you, Wendy. What is equity for you? True, honest, and supported equal opportunity. Thank you, John. When you think about opportunity in terms of job, in terms of employment, in terms of access to things, diversity of the researchers studying disability and who have funded projects, concrete ways to measure inclusion in research projects. Thank you, Susan. Ensuring that people have equal opportunities and high expectations for success. Yes. Ability to participate despite individual needs. Excellent. Everybody is provided with what they need. So equity also in terms of capacity, access, resources. Thank you. So we'll get into our definition of equity, or one of the many definitions of equity that are out there. Before we do that, I do want to say that I have learned a lot. Gretchen, the slides are not helping you today.
Oh, I am so sorry.
Would you like me to hold the slides? I'm happy to do that. Can I?
That's okay. Just I will wait and tell me when to move them along.
You can go to the next one. Representation great enough to challenge a dominant structure. Thank you, Melody. So I will say that one of the things that when I talk about equity is also thinking carefully from multiple levels, right? So usually when we think about equity, we think about things like things that you've shared in terms of resources, in terms of opportunities, funding, big platforms, big thoughts. What I also have started to think about is equity in terms of little things, and I call them little A's for advocacy. I don't know about your context, but in my context, we have a lot of materials and a lot of flyers, a lot of, I don't know, manuals that we put out there, a lot of, things that we put in our organization. And when we do that, one of the blind spots that I had was in the context of, funny thing, talking with this audience, disability. So Gretchen and Melody actually have been teaching me a lot in terms of how to say audit my slides, which were pretty ableist for people with visual disability. cliparts are actually a problem in the context of stereotyping. So I do a lot of work with Latino families. And when I go clipart for Latinos, stereotypes are all over the place. So the way that I started thinking about equity has been also been thinking about as I put materials out there and as I develop flyers, and we're going to talk about other examples as we go on, how does my slide, my words of choice, my font size, the metaphors that I use, how do they embrace or not equity? And we're going to talk about more. Thank you, Deborah, for joining us. So, and this is also, we're talking. So if you have any questions, please ask. I'm paying attention to the chat, so you feel free to ask. Gretchen, if you don't have anything to add, we can go to the next slide. So as we think about equity, it's important to think about the distinction between equity and equality. And I love this figure for many reasons. So the reality is you're here because you might know that some of the privileged people have more access to resources and resources in general than other people, right? So you have even the little guy there in a hole not having access to the game. Equality is everybody receiving the same type of resources in an equal manner. So I am an interventionist, meaning so I am giving the same intervention to everybody. That's equality. Equity is me thinking who needs what, how, and how can I adapt my resources to meet people where they are. Note that equity is different than the diversity. And diversity does not mean equity. And that's a very tricky conversation, right? So me being in a room full of different types of people does not mean that the work is reaching equitable work. But equity means in a diverse group of people, I am adapting, iterating, giving access to people. Now, equity is also different than justice, than social justice. As you can see in the equity, we still have the barriers to access, right? So for example, I still have chairs to entrance to my building. Justice is me liberating from those barriers. It's me putting a ramp so everybody can have access to my building, for example. It's me being very attention and very thoughtful about the materials that I'm putting out in my organization. That is justice. So I want to put a pause here and see if there are any questions, reflections about this particular slide. Peter, I think the slides are going to be shared. Gretchen, Melody, do you know?
Yep, we will share them. We'll send them out, and we're also sending out the recording as well.
Awesome, thank you. So as we think about in your work, and I would love for you to think about how would equity and justice look like in your setting, and how can we reach really from equality towards equity and potentially towards justice. Yes, Susan, so exactly. So how, in terms of, I am an implementation scientist, right? So when we think about implementation science, you think about not only the interventions and how to design the interventions, but also the strategies. So there is a lot of literature now in some of my work talking about the importance of adaptation and importance of adaptation also as part of reaching equity. So for example, if I take this out from a context of employment and put it in, say, in parent interventions, which is some of my work, I might have a parent intervention that I know works really well. But if I am to do equitable work, I need to adapt this intervention to reach different types of communities. I also need to adapt the strategies on how do I train the interventionists so they can reach the communities where they are, right? And that is where the equity and justice comes. Where are you implementing those interventions matter a lot. How are you implementing those interventions matter a lot, right? The line between intervention, adaptation, and not having enough fidelity to measure impact. So that fidelity is a whole bucket of, and I would say a whole nother webinar, because fidelity is a tricky piece in terms of, for you to know what fidelity, how to measure fidelity, you also need to know what the core components of your intervention are, right? So there's that. And so some interventions are more mature than others. You might know, or you might suspect the core components of that intervention. Then the other piece is how to measure for fidelity, right? So the golden pace would be observational, meaning say record, and then we can observe, and then we can have a checklist. But that's not usually or not necessarily always feasible because it's also expensive. So you can have self-report, you can have audio report. So you have what is fidelity in terms of then you have the methods, how to track fidelity. And then you have another question, which is how to track adaptation as you adapt the interventions as you go, so you can reach equitable work, right? And so there's a lot of literature, and if you're interested, let me know, send me an email. I'm happy to have this conversation. There's a lot of literature in the adaptation field of implementation science, trying to struggle with those questions in terms of methods, measures, how to define core components at the intervention and implementation strategies. Absolutely. Just let me know. Any other questions in terms of equity? How would equity and social justice look like in your context? No? Gretchen, always jump in if you want to.
I will. Thank you.
Yes. Let's go to the next slide. So we were just talking about implementation science, right? So this is a very simplified model from Enola Proctor et al. Talk about what could be implementation science. So you have the evidence-based intervention. That intervention then we need to figure out how to implement an intervention in context, right? Those are the implementation strategies. They might be, say, training, workshop. I might be reorganizing the structure, the financial structure in your setting. So those are the strategies, which then are also affected by implementation outcomes. Things like we were just talking, fidelity, things like feasibility, adoption. If I train everybody, would everybody then learn how to do what I'm training to? Then you have service outcomes. Service outcomes there too that are super easy for me to think about. One is in terms of the hospital setting, the timeliness from the time that you entry and from the entrance of the hospital to the time of service, right? The timing is really important. And equity is by the Institute of Medicine posted in service outcomes. And all of those middle things then affect patient outcomes, right? So you might have the best intervention, but if you don't know how to train, or if the intervention is super expensive, or if it's not feasible, then you might not have the best patient outcomes. So that middle point is what the implementation science does. What happens now is, Gretchen, if you go to the next one, we're seeing more and more, and I think COVID has shown us explicitly and put it in right there in front of us, is that social determinants of health affect all of this. You might have the best intervention, you might know how to train, you might be feasible, you might, provide patient outcomes, but if your patients or your population or your research participants or your employees do not have housing, what is the point? If they don't have transportation, or if they have to spend 2 hours in a train to come be with you, what is the point? If they have to choose between buying food or drug, what is the point, right? Legal, immigration laws, if they experience racism, prejudice every single time that they come to your organization, it doesn't matter if you have the best intervention. If they are social isolated, or if they have disability, or if you have then their interlinear sections in terms of discrimination because of their gender identity. So what we are struggling in the field is, now that we have a lot of evidence-based interventions, that we have all the methods in terms of implementation science, how can we deal with this thing called context that trickles down and affects everything in terms of equity? So, Gretchen, next. The thing is, none of this is new, right? We've been talking about disparities in healthcare, disparities in care in general since the 70s, and we've seen this since forever. Colonization is based on inequity, right? And money and finance structure. The problem is what to do now. So next. So how do we then promote equitable implementation science? And thinking about going now back to your definition that health or equity is not just the absence of suffering, it's not the absence of disease, but it is the presence of resources and the support so people can thrive. So next. There's a lot of work, and it's an important set of work in terms of trying to figure out how to measure social determinants of health, right? How can we, for us to tackle something, we need to be able to measure it, right? And there's a whole body of literature in terms of how to measure it, how to define it. There is more movement now in terms of not only measuring social determinants of health, but measuring racism and discrimination and how to deal with that data and the ethics aspect of that data. Next, Gretchen. So the question that we pose for you is, it is showing. How is racism and discrimination showing in your work? So let's put a pause and let's think. If you define a discrimination as the unjust or prejudicial treatment of different people or things, how does it look like in your setting? You can use the chat, or you can engage in the verbal conversation. And it's okay. We'll sit down in the struggle. So let me show you one way that discrimination is showing up in my own institution. Oops, not yet. I have been involved in a couple of initiatives talking about, especially after pandemic, talking about family life balance and work. And I started involved in this because as a mom of little kids, a single mom, I was just falling apart. And so the university started having several workshops and several conversations about family life balance and how can we deal with all those things, you know, changing meetings from 5 p.m. to lunchtime so then we can go home, etc. But then, as we were having conversations like this, one person shared that as a transgender person, when she saw the materials and when she saw the way that we were engaging with this concept of family, she did not feel welcome because hers was not the traditional type of family. And because her biological family just dismissed her, so her family is a chosen family, and how to balance that. So that's a clear discrimination. Even though we were trying to be inclusive by using family and caregivers, by the simple fact that all of us were heterosexual, we didn't pay attention to the underlying assumptions that we were having and the way that we were engaging and having those conversations. So even when you have good intentions, oftentimes just because of your culture and your background, someone might not feel necessarily welcomed. Hence the importance of diversity. Susan, excellent point. And I want to say, Michael, we can go back to your question. I see your question in terms of continuum. We can go back later to your question. I don't want to not talk about that. Rebecca, exactly. So some pieces of the interventions are only accessible to people with technology access, right? So pandemic hit, we all went online, which is great because it increases the reach of the interventions, but only for those who have access to Wi-Fi, right? Or for only those who have access to a computer, which is really, it's a catch-22. So I do a lot of work with people with sickle cell in terms of drug adherence. And what we are seeing is that because a lot of those, well visits with the physicians were moved to online, patients were more engaged because they didn't have to come and travel 2 hours to come to the hospital. But at the same time, they were not necessarily as present because of the Wi-Fi and technology, et cetera. So it's always a catch-22, right? Susan, yes, too much here is in English. Advisory board, the design of the questions, and we're going to talk about how our questions are not neutral and the importance of really thinking and engaging the community as you're even conceptualizing your research question, right? I just talked about the family piece. Proactive on training and technical assistance to address implicit bias in the referral process. Kelly, yes, I would love to have more literature in that. There are some literature in terms of in the medical setting. I don't know which setting you might be, Kelly, in terms of bias from physicians, right? There are tons of data, for example, in the emergency department, and I will go back to sickle cell because that's the population that I've been working with. So I don't know if you know, I didn't know in my innocence. So people with sickle cell disease are predominantly from African-American contexts, the majority from low resource settings, and they have pain episodes, major pain episodes. The description that they gave us one day was, imagine that you are in a bathtub full of needles, multiply that by 10, like that you cannot talk, move, breathe because you're in pain. So the only way to treat that, thank you, Kelly. The only way to treat that is to go to the emergency department and have opioid, because opioid then calms your system down. Now imagine a person with African-American descent coming to the emergency department asking for opioid in the context of opioid fight that we have right now. It just doesn't work, right? And so there is some work in the context of hospital setting talking about implicit bias from providers in trying to assess and give support. There is a book, we're going to talk about this book later, Diversify, where she talks about implicit and explicit, and I should know her name because I really like her work, implicit and explicit bias, and how to, as you engage with those conversations and start labeling and putting out on the table why you're asking those questions, and who would benefit those questions from those questions, and who would be potentially receiving the negative aspects of those questions. Having those conversations ahead of time might be helpful. So, for example, I'm a parent interventionist. We moved from engaging moms to moms and dads to caregivers. And now, as you saw, even the word caregiver can be exclusive of non-binary, non-traditional families. So we need to really think about how we engage, right? And who are we engaging, and who is absent, and why. Gretchen, I don't know if you have any other thoughts. Kelly, I'm just vomiting answers.
Yeah, I mean, is now a good time to go to the slide, the slide that I'm gonna.
Yeah.
So I thought this would be some good content to follow the previous slide, because so often when we say to researchers or clinicians or anyone else who does this work, you know, how is racism showing up, or how are various forms of discrimination showing up? It's kind of oh, I have no idea how to even address that question. So if you haven't ever read any of Dr. Kamara Jones's work, I would say check out, at the very least, check out the the citation I have here. It's on the last slide. You can also email me if you want the link to the open access article. But the reason why I always include Dr. Jones's work in these types of presentations is because not only is she one of the arguably like the expert in addressing structural racism in North America, she gives just a very kind of simple equation of how to do it. So what she says is the first thing you have to do is name racism. So you really need to be able to define what is racism, and especially in the context of structural and institutional racism. And to do that, I mean, I always suggest people use Dr. Ibram X. Kendi's really simple definition of a racist policy, which is any policy, written or unwritten, that results in an inequity, right? So, so however you want to define racism, you have to do that before you can kind of get into talking about how is it operating here. And so, and that's her next step in addressing racism. And why do we ask how is racism operating here? Well, we have to do that to identify potential interventions for racism or other forms of oppression. And we look at, we identify the structures, the policies, the practices. And when I say policies, it's written and unwritten, the norms and the values of your organization. You have to be able to do that to make it to the third step, which is to organize and strategize to act. So specific interventions for addressing institutional racism. And I want to finish up this slide with just quoting Dr. Jones. This is from this article from 2018. She's been saying this for a long time, but I think this is a quote that I like to look at a lot before a meeting, after a meeting, when I'm kind of thinking about it. It's very much, for me, grounds me in kind of why I do this work and how I do this work. So what Dr. Jones says is, in evaluating these mechanisms of racism, we need to be especially attentive to absence of. Who is at the table, who is not? What is on the agenda, what is not? And when we note absence of, we need to take action to fill the gaps. And so importantly, we need to become vigilant in identifying and addressing inaction in the face of need.
Peter, this is where the hard work is. And this is a very busy slide, which might speak a little bit about your question in terms of institutional racism is a thing, right? And it's not, we're here, let's change. It's not easy to change. because it exists for a reason, right? And racism is an economic aspect. It giving up privilege is really hard for those who have been benefited from inequitable work. And so there are multiple strategies, and I think I will say one is identifying your champion. You need to have your champion at the leadership level, right? And if there is any silver lining again from COVID, this is a time to talk about equity. This is a time to talk about racism. We're seeing it in multiple institutions. It's on the news all over the place. But I am not in the power. I don't have power and positions in my institution. What I do have is advocacy behavior. So little things like, have you edited your PowerPoints for visual disability? Or there's a lot of males here in the meeting.
Those are the winning numbers and letters that you'll ever need in this life.
Thank you. And so questioning or making explicit some of those implicit aspects through questioning, through reflection, I have seen helps people conceptualize and think better. There are some work in, Diversify. Camara Jones is fantastic. We posted a couple of other podcasts of people that have been doing a lot of that work. Again, I'm in the healthcare settings. So Utibi Hussein in his work have done podcasts, and he has released several frameworks in the context of training, in the context of healthcare disparities. But if you take a look at this slide, again, very busy slide, you need a multi-level approach, right? You need to engage leadership because diversity matters. You need to engage middle people who have voices to help you identify who, like Gretchen was saying, who is present, but most important, who is absent and why. And then you need to think about, in your context, the customers, who is coming and who is not coming and why. How is your organization welcoming people from different settings, from different sectors? Access is really difficult, and I think part of it is, right, going back is funding. So we've had multiple conversations at the National Institute of Health in terms of, we don't have a lot of funding to give us time to engage with the community, right? Because I shall not sit down and say, hi, I have this important agenda. Let's do this intervention here. You have, if you are to truly do equity work, you have to co-create, collaborate. And that process is long and it's really difficult, right? Because it's learning how to dance together. There are some fundings now in the context of NHLBI, NCI has been putting a lot of racism. So National Cancer Institute, National Heart Lung Blood Institute, the National Mental Health Institute. There are some fundings, and some of the funders have been asking for research for information to help us think about what would collaboration with community look like, and what would the outcomes of that collaboration would look like, so then funders can fund this, right? PCORI has been a model, I think, a fantastic model to engage community, because part of it is they ask explicitly how the communities are engaged, and they have community members at the panel as a reviewer. But you're absolutely right, that there's all sorts of levels and barriers. Division the same rate as population to state. I'm not sure in the exact measure. I don't have a lot of thoughts about those your point, here's another struggle that I face. Didn't follow, hopefully, Susan. Here's the struggle that I face. So I came to equity work. So as I mentioned, as a Latina, doing a lot of work adapting evidence-based interventions for Latino communities. And I've learned how to do that in Logan, Utah. So our sample of Latino was, to your point, Peter, population level, we were reaching, we were all over with the Latino population there. But then when we took that to the United States, the population looked different, right? There's a point that, an additional point where, Sherry, I don't know what's happening.
To give you a card back and give you a wristband, okay?
Okay.
There, I'm good. Sherry, I muted you because I don't know if you were trying to talk with us or if you were having a parallel conversation. If you're trying to talk with us, feel free to unmute yourself and engage in the conversation. So the challenge that I have in terms of how to manage with that data, Peter, is that the Latino population that we were having access to in Logan, Utah, were majority from Mexico. And when we took that intervention, say, to Michigan and to Mexico, we went it back, the intervention had to be adapted again because the Latinos from where we were not the same, right? And so that goes back to the question that we were talking about in terms of what were the core components. How do you track fidelity? What is the goal of the intervention? And how is that bounded by the geography where you're hosting your trial, right? Suchin, does that like the season? Yes, Deborah, can I? Absolutely. There are so many people way more expert than, especially because of the lived experiences doing this. And the challenge that we're having and the conversation that I'm having with multiple people that are asking me, so how can I learn about equity? The simple conversation is just sit down and listen. Equity is a big chunk of the work is through process. So listening and bringing the people who have been doing this work and have lived experience, who are in the community doing this work, are the ones that should be getting funded and getting the resources. So yes. Any other reflections about this particular slide, about the conversation that we were having? Melody, yes. So absolutely. And we are having conversations again at the national. There is a catch-22 with bringing community through research projects, which is timing that you spend working in a research project is not necessarily equitably funded if you're in academia versus if you're in community. So time is a sort of determinant of health, and how can we equitably, thoughtfully pay our community members to be co-collaborators in our work. So my salary, for example, comes from lines on my CV, right? So-and-so's salary does not come necessarily from lines in the CV, but so-and-so is doing more work than I am because so-and-so is part of the community. And so as we think about those things, and there are some, Lori Carter and her group in Michigan, Leo Cavazza, there are some people writing about the financial structure of projects and how can we be really thoughtful about spreading and thinking about, we have things like indirect, how to pay our community members for the amount of work that they're doing so we can be all together in this space. But yes, absolutely, to what you all are saying. Gretchen, if you can go to the next slide. So you can place cancer to any other disease, I guess. Oops. And I think we are at a crossroads. At least that's how I feel in the context of the field of implementation science. The field of implementation science was born to decrease the quality of gap, right? That's a definition. Decrease the quality of gaps by implementing evidence-based interventions in usual care. That's how I was trained to conceptualize evidence implementation science. But we're seeing that social determinants of health are trickling down. Context is affecting all of that work. So now we need to figure out what to do with that. And to me, now we can go to the next step. It's going back to, Gretchen, if you can go to the next slide, to our research questions. And unless we have a really difficult conversation in the field and reflection about how our questions are not neutral, how even the definition of evidence-based intervention is not neutral, we're not going to be able to decrease the quality gap, right? We're learning a lot. There's a lot on the field. We've moved the needle, but I don't think we've moved the needle faster enough or equitably enough. Is that how you say it? Yes. So we were just talking about how our process is not neutral. One of the things that we need to be very careful about how we might be colonizing our work, as we say, implement evidence-based intervention. If we are not sitting down, learning and listening to those who actually need the work that we are doing. So those are strong words. And I'm fully aware of that. Do put in the chat your reactions and your comments and what you think about those things, because we are at the crossroads, I think. You can go to the next slide. So what does that mean? It means that I would love for you to put in the chat in terms of how are you conceptualizing your research questions? Who is giving feedback? And what are the potential negative impacts of your work on historically marginalized populations? So I mentioned to you, I'm a parent interventionist, and we keep changing the labels as we learn about how engaging moms was not equitable, moms and dads, no, families. And now we need to think carefully about how we're even thinking about engaging, recruiting our participants in what it was, I think, a parent intervention, and now it should be a caregiver family type intervention because we left people out. So how are you getting feedback on your research question? And if you're not, what are the barriers? I love this because I don't know if the silence is because you're typing or it's because it's silent. So hopefully you're typing. Hopefully you're thinking. I'm looking at the time and I have a couple more slides that I want to go through. So I'm going to go through the slides, and I really would like you to write down, because I think this could be a co-learning from all of us, not just us sharing our slides. So please write down on the chat. Gretchen, if we can go to the next one. So we were just talking about, right? the question to us, I think, is what would social justice employment implementation study look like? How could you address or not? How could you account for social determinants of health as you do your work? Next. Advisory boards are the best, I think, one of the best ways. And there's a science to that, right, Andy? And I would love if you have any resources to share with us about how you're putting together that advisory board for us to learn with you. If it hasn't been clear, I think I've said at least 4 times, as you do equitable work, the importance of listening. And I love this panel because it was put with a lot of love with people from different communities. And we asked them, what would social justice or liberation look like for you? And they had, in some ways, similar answers, but in others, very different answers. Because depending on the context, social liberation might look different. I will offer, going back to the conversation that I had with a person who is a transgender woman, and I have now started asking those questions to every single person that I do equity work with. So we were talking about implementation science, and I was talking about parent intervention, et cetera. And I asked her, so what would liberation look like for you? And I get emotional. She paused. We were in Zoom. She looked at me and she said, all I want is to go to the bathroom and not be afraid of people. So here I am talking about parent intervention and evidence-based intervention and implementation, and all that this person wanted was to be able to go to the bathroom. A simple thing in a safe manner. So what's the point of my work doing all this implementation science if someone cannot come to my work because he or she might not be able to feel safe going to the bathroom, right? So what would liberation look like for the community members in your work? And how are you listening to them? Next. Thank you, John. If you can share the resources, I would really appreciate. I think we can all learn from you and together. As we go through and do this work, the importance of listening and engaging and thinking carefully about who are you engaging with, right, matters. Because if you're hanging out with the same people, then you're only listening, it's your chamber, right? You're listening to the same voices only. So who do you follow on social media? I'm a fan of Twitter just because I'm following multiple people from different places. And it's impressive to me to know how my blind spots are so deep, right? So who are you reading? Who are you citing? Who are your co-authors? People from academia. And of those, who is the first author and who is your last author? Right? So who are you leveraging as you do this work? Next. And if there's anything at all that comes out of this workshop, is that equity is reflection. Equity is not about a checklist. Equity is not about a measure. Equity is not necessarily just a methodology. Equity, if it's not hurting, then you're not doing equity work, I guess, right? So you saw my pain about the bathroom, and it's still, and I've connected with this person multiple times. Like, how can I help you? How can I use my privileged voice in the context where I am so I can leverage your story? And as you do this work, I love this figure because in some places you might be the disruptor. So for example, when I come to my, when I'm a panel reviewer on communities, on conferences, I ask people whether they have reviewed their PowerPoints for people with disabilities, right? Have you audited your PowerPoints? So disruptor. In other places, I am a weaver. I weave in the stories so I can leverage and do advocacy. In other places, I am just a listener. I'm here. I'm listening, right? So learning how to navigate and learning where is your point and your strength is also important, because it will help you think about how is your advocacy work as you do those things. Next. So, if anything, think about how we are, not you, no, how we are listening to stakeholders and note your point of resistance. There will be, right? So when someone says, that's light on it, jeez, we had to do the alt tax and write down for all the figures, and can you be less ableist? That was a point of resistance for me. It hurts. If it's not hurting, you're not doing the work, right? It's part of the pain. What are the implicit assumptions about your research questions? What are the implicit assumptions as you engage with people? We have them, and that's okay. It's part of nature. We're humans. We'll fail, right? But what you do with them and how do you address them is the next step. I think that's the last slide, Gretchen, maybe. So we have resources for in podcasts. I especially with pandemic times, I've been trying to do exercise, walking or driving or cooking. So podcasts now have been my founded love. Steph Johnson was the person that I was talking about in terms of Diversify. I love this podcast with them, with Dave Stachuk, where they talk about diversity and how she shared some strategies to diversify. Priya Parker is my recent academic crush, in the sense that Priya has been talking about how can we be more thoughtful about our meetings, about our encounters, about what we do. And so she has, if you Google her and if you go to her website, she has actually a booklet making explicit the implicit assumptions of your engagement with others. And it's a really important work as we do equity work, as we come back to work or not, or as we do the hybrid model. She has an episode of Dare to Lead with Brené Brown where they talk about equity and going back to work, which is fantastic. Be Anti-Racist, Ibrahim Kendi, Clinical Problem Solvers, Flip the Script are podcasts hosted by Black scholars in the context of medicine, but I think you can plop any of other contexts to their conversations and it will be really helpful. What other resources we have? I think we have, there are special issues. If you are interested, we have a group called CARDIS, Collaborative for Anti-Racist Dissemination Implementation Science. The website is right there. We have some action items. It's an open group. You're more than welcome to come learn. The website is there so you can learn about what we're doing. And I think that's it.
Yes, thank you so much, Dr. Bowman. And I just want to say that I will go through all the chat text, and if there's specific resources, I'll put them all together and I'll send them all out along with a copy of the video and the PowerPoint slides. And you all have my email address because I emailed you the Zoom link this morning. So if you have any questions or feedback, feel free to shoot me an email. All right. Thanks again, Dr. Bauman. And we look forward to seeing what's to come in the future from you as well.
From all of us. And I appreciate you have my email to engage, to talk. We're running out of time because we've embedded the questions in between. But if you have any questions, this is an ongoing conversation. Connect with us. We're here. Thank you.
Thanks, everyone.